Hi guys, it's Shimona Clark, family nurse practitioner for Clark Nelson and Associates, and I'm back with another cup of the morning coffee. Now, today we are going to talk about inhalers, specifically the Pro Air albuterol inhaler, which is also known by many of those of us who have asthma as the rescue inhaler. This inhaler is very important because as a patient becomes short of breath and they start wheezing, which means everything is inflamed inside of your respiratory tract, also meaning you're not getting in the appropriate amount of air, which could lead to the patient passing out, basically suffocating. So I'd like to educate and train on this inhaler because it's going to be the one that you see people utilize most, kids out at the soccer field, and it's always good, especially because everybody does it. Even if you educate people on how to use this, if I'm the patient, when I'm in distress and I cannot breathe, sometimes I forget what's happening, and so I'm using it inappropriately. Other times, for instance, I just went to get this refill at another pharmacy, and of course I have had these for years, but they didn't even ask me if I knew how to use it. They didn't ask me. This was not actually a refill for that pharmacy. This was a new prescription. So, now I'm left to YouTube or the Facebook students to tell me how to utilize this. So now what we're going to do is educate you on this, and here we go. Now, the first thing I want to make clear and kind of educate you on is the respiratory tract. And of course, I'm not going to delve deep into that because you don't need to know that. But it may help you to understand how something works so that way you can use this appropriately and understand the importance of it. So, obviously we have two nostrils and the air goes through there and down into our trachea. And then we have two lungs. We have a right lung that has 3 lobes and a left lung that has 2 lobes. Now, even though there's 3 and 2, all 5 of the lobes work together for gas exchange. Oxygen, carbon dioxide, all of those gases that the human body actually needs and that we must exhale from our bodies, that's what's happening in those. Now, I'm a big proponent for pictures, so this is something that I have here in my office that I show patients. So you won't be able to see me, but that's fine. You've already seen me. Again, this is the nose, and so you're going to breathe this in, and it's going to go down here to the trachea. From the trachea, this pipe branches off into 2 bronchi. That's these little things. And then each bronchi branch off into more bronchioles. And then from there, it gets a little more complicated. So we won't cover that. Maybe we can do that in another video. But just know that inside of these little sacs are things that look like grapes. And that's where the gas exchange happens. So during an asthma attack, what's happening is all of this is constricting or tightening up. So the air can't get through. So think of a water hose when you bend it, or even a straw. When you bend it, a little bit of water still goes through, but guess what? Not all of the water can go through. And then when you relieve that pressure, now it can flow regularly. So that is basic respiratory, just so you kind of know. And again, what's happening during an asthma attack or anything like that is all these spaces are tightening up, and so now I can't hardly breathe and I'm wheezing a little bit. So that's where the Pro Air inhaler comes in. Now, before I actually get to this, I'd like to show people the box, because the box of any medication, but specifically this one, gives you a lot of information on it. Not only does the little tab give you the directions on how to use it, and it's very important because this is a medication that causes bronchodilation. So if you are not short of breath, you're fine. You should not want to dilate your bronchioles or the bronchi that we just discussed. You don't want to do that. it's not good for you, and there's no reason to utilize it. Plus, you don't want your body to kind of build up a memory to the medication. So inappropriate use is never recommended, obviously. So this is my personal inhaler. They said I have asthma. I don't have asthma. So with my inhaler, my doctor has instructed me to utilize it, inhale 2 puffs by mouth every 4 to 6 hours as needed. Now, I don't really use it because I don't have asthma attacks, but there have been a couple of times where, like maybe if I had a bronchitis or a bad cold, that I have felt a little tight and started to wheeze, so then I will utilize this. So it's just a good thing to know what the directions are. Because once you take this out of the box, as you see, there are no directions on here. So, also on here, it also tells you how many doses you should be able to get out of this. So it says 200 metered inhalations. So if my dose is 2 puffs, that means that I'm going to be able to use this 100 times. Because I'm going to take 2 puffs. So this also tells you, like for travel use, this is 8.5 grams of medication, and it's usually 3 milliliters. So you usually don't have any issues with these types of things. But if you have, other types of inhalers, you probably better make sure that you know how much is in there. Let's see. It gives you the warnings on the side of the package, and then how you should store it. So your storage of the inhaler. You don't want to leave this on a dashboard in your car because that's too hot. You also don't want to put this in the freezer. And trust me, I have seen people, because they think the freezer prolongs everything. It does not prolong this. It actually speeds up the degradation of the medication. Now we'll go to our handy dandy inhaler. So there's a couple different parts to this, and so I'm going to take you through them, so that way if you see it or if something's missing when you see one, you want to make sure that you are looking at the inhaler to make sure that it is working appropriately. So you have the vial with the medication, which is here. So you'll see that. On the side of it, this gives you actually the expiration date. Please don't use these past the expiration date. I understand a day or two, but I had a patient back when I did home health care, that the lady was complaining that her inhaler was not working for her anymore. And then I asked her to see the inhaler, and the inhaler was like 7 years old. So that it's not helping you at all, because now the medication is degraded beyond a therapeutic level. So the second part, you've got the casing here. On your casing to hold the medication vial in place is, many of the newer ones now have a dose monitor. So after each use, this should go up for me to this number. Now, I have not used this, so that's the reason why you can't see a number there. But as you use it, so then it's going to tell you when you are getting close to the end of this, because remember, our box told us there was 200 doses in here. Now, what I also like to tell the patients is, please do not wait until you're at 198 doses given to then try to make a doctor's appointment and you use your inhaler 2 to 3 times a day. Because most of the time you can't get an appointment that quick, and pretty much now you just don't have it, so you're going to end up in the emergency room. And for me, the emergency room is not the optimal place for my patients. I would rather be able to manage them in office, at their house, wherever, but just don't wait that long, because this is a rescue inhaler. Now, another portion of this, and hold on just a second, I don't want to break a nail, so that's why I'm trying to be a little more safe. So you have the mouthpiece cover, because remember, this is the casing. So here is the mouthpiece. This is where your medication is going to be expelled from. And then this is just the cover. It's to cover it. So if you happen to pull this out of your purse and this is off, you could put this in your eye, spray it in your eye, spray it in someone else's eye. Maybe someone else has an allergy to this medication and it's an aerosol. So once it gets into the air, it could be harmful to others. So keep your mouthpiece casing on here. Also, you need to clean this, I'd say once a week. As you see, I have on lipstick. So for those of us who wear lipstick, lip gloss, chapstick, maybe you're eating and you feel a little short of breath and you take a couple of puffs. Well, there can get buildup in here. So we want this area to be clear. You can clean it with a Q-tip, paper towel, whatever you can get in there. And then this actually comes out as well. So now you've got your 3 pieces. And all you do is stick this back in. You want to pop it down to where you meet resistance. Don't push, because then it's going to expel a dose, and I don't want to waste any of my medication. So now I can, and it goes back together that quick. So if you find one of these and it's not put together, that's how you put it together. Now, utilizing this. So I want to sit up straight. And even if I'm a patient that can't breathe, don't allow them to be slumped over. This makes the lungs smaller. Best case, you can have them even lay back. But you want to elongate these lungs to get the most oxygen in and out. Now, in order to use this, and I'm not actually going to spray it because I'm not having shortness of breath and I don't want to create any other problems. So, but I would have the patient or myself take a deep breath and expel the breath. At the end of that breath, I will insert this in my mouth. And during this time, as I inhale, I take a squirt. So I would depress this as I'm inhaling. And you see how I just held that. So I want to hold that breath and hold that medication in there for as long as I can, so that the bronchioles, alveoli, all of that lung tissue can be treated. Now, my order is for 2 puffs. So I'm going to do what I just showed you twice. So now, instead of talking, I'm just going to show you in real time. So now I have taken my 2 breaths. I'd like to teach this with any inhaler, so that way if your disease progresses and you end up having to have an additional inhaler, something that's more like a steroid or something like that, you have to make sure that you rinse the medication out of your mouth. So just a little water, swish it around, gargle it around in the back of the throat, and spit it out. You want to do that every time because it can cause buildup. It can cause the throat and mouth to be a little tender and sore. Or even if you never do it, and especially those of you who still continue to smoke with using this, it can just cause some other tissue damages in the mouth, and we don't want to do that. And it also can degrade your teeth and enamel. So again, this has been the albuterol Pro Air inhaler that we have talked about. So this is a rescue inhaler. So this is one that if you have asthma or your loved one, they have to have this. So if they don't have it now, you have to go back to the physician or MP or PA that is in charge of your care, and you ask them, if I have a diagnosis of asthma and I become short of breath, what is the inhaler that I need to have? So these are questions for you guys to take back to your providers. And you want to ask them, can I have this inhaler? Now, they may have done some other testing where they deem that you don't need it, because maybe you have a mild asthma or just an exercise-induced asthma. Sometimes they do not provide those. However, I think any diagnosis for me as a provider, my patients will all have a rescue inhaler, because you never know when it's going to hit you, or as your condition may get a little worse. So, a quick recap. We've got an inhaler with our 3 parts to it, our metered dose. We can also see when the inhaler has expired. The box that it came in gives us a lot of information on it, including the directions, which are important. We know that you breathe in air through your nose. It goes down to your trachea. You have a right lung with 3 lobes, a left lung with 2, and that trachea branches off into 2 bronchi. And from there, the bronchi have additional stems that are called bronchioles, and that is how the oxygen and gas exchange in the body works. So this has been another morning coffee, and I am Shimona Clark, family nurse practitioner for Clark Nelson and Associates. Thank you.